thank everybody for coming to this conference. We're hoping to give you information about the preparedness of Northern Maine Medical Center and any other questions we may be able to answer for you. What we ask for the convenience and time constraints that we have, that our staff, Dr. Mike Sullivan, our Chief Medical Officer, and Alexis, our Director of Nursing, here to give you information when it's done. We ask that there will be no other interviews. We will have an update later this week, but for now, we'd like to keep it to just this information. And any questions you may have, we'll have plenty of time for questions, so we'll be here for that period of time, but then we will end it there for the public. We also have our board chair, Norman Forney, who's very supportive of what we're doing here in the audience for us. And I'll open it up to Dr. Sullivan and others. Thank you.
Hi there. I'm Mike Sullivan. I'm the Chief Medical Officer at Northern Maine Medical Center and an emergency medicine physician here as well. I'll give you some background information on what we've done at Northern Maine Medical Center in preparation for Ebola virus disease, and then talk specifically about what we're doing in terms of the current situation with the Kathy Hickox, am I pronouncing her name correctly?
Casey.
Casey, the nurse who's recently back from travel to Africa, assisting in the care of these patients. With regards to Northern Maine Medical Center, we've been preparing for potential care of an Ebola virus disease patient since the case in Dallas was announced several weeks ago. We had an emergency preparedness meeting immediately. We've had several meetings, education meetings with staff, emergency medicine staff, as well as in the entire hospital. We've had several mandatory education training sessions. We've had multiple staff education sessions. Our ER staff has had additional training, as well as our ER providers. We've all been versed in doffing and darning our personal protective equipment. And we're prepared to take care of any patient that should present to Northern Maine Medical Center with potential Ebola virus disease. We are equipped, but we are not a regional care center. We are not a tertiary care center. And so our point would be if a patient presented with Ebola virus disease or symptoms consistent with Ebola virus disease would be to stabilize them and transport them to a regional center. We've been in communication with Sheila Panett, the director of the CDC, as well as Mary Mayhew, the Commissioner of Health, in terms of the state of preparedness for the state of Maine, where these regional centers will be, how patients will be transported, how patients will be monitored, and so we're in daily communication with them, especially in light of the recent concern with regards to the Casey Hickox. Anything else you want to add?
No, we've established probably for close to 3 weeks now our screening protocols done in the emergency room and our primary care physicians, because that's the first step where we can identify a potential patient who could be at risk for Ebola, and that's been in place now for well over 3 weeks.
I should clarify, although this is a scary disease in terms of the presentation and the mortality rate, it is a preventable disease with appropriate precautions, and that our hospital is equipped with all protective equipment and protocols in place to ensure that there's absolutely no public safety risk. We have a separate isolation area for any patient that would present with Ebola-like disease, separated from our emergency room. We have the designated caregivers to care for those patients. All of our patients that present to Northern Maine Medical Center are screened, and they've been screened for the last 3 weeks. So we've had no needed change in any of our policies or procedures, and there's absolutely no risk to the public, although it's scary. It's not something that is going to be of concern to us should we have a patient present, because we're prepared. So I guess if anyone has any questions.
Where would you send, you said you would be stabilizing them and then transporting them somewhere else. Where would that be? A regional care center, where would that be in Maine? Or would it be Maine?
Yeah, so the last direction that I have from the CDC, the Maine CDC, is that It would depend. If the patient presented to our facility, our primary tertiary care facility referral center is Eastern Maine Medical Center. But if the patient is being monitored by the CDC and they develop symptoms, so the latest protocol from the Maine CDC and the federal CDC is to have daily monitoring, direct or indirect monitoring in home. And if during that monitoring they determine that the patient became symptomatic, they would at that time be arranging for direct transport from wherever the patient is being isolated or quarantined or on home, voluntary home isolation. They would arrange for direct transport. And that would go to whatever facility they direct. If it's a patient that's under surveillance by the CDC and they present, we would contact the CDC and ask them where they want to transport it, the patient transported. My best understanding most likely would be Eastern Maine Medical Center, and I would anticipate that the regional care centers for the state of Maine to be Eastern Maine Medical Center, Maine Medical Center, and Central Maine Medical Center. That would be what I would anticipate. And possibly Maine General Medical Center, I'm not sure about.
They've been having some discussions with the director for Maine EMS system in regards to protocols and training and establishing that transport.
And what are you hearing at this point from Maine CDC in terms of her plans to return to Fort Kent, when she plans to come, and does she still intend to do the self-quarantine?
So in conversation with Sheila Panett, the director of the CDC today, she tells me that Casey is agreeing to the monitoring, direct and indirect monitoring by the CDC and the 21-day isolation period, but I do not know where she plans to do that.
Lindsay Janice, ABC News. There's a lot of panic in the town and the community. Some of the students who go to school with Casey Hickox's boyfriend, Ted Wilbur, said they didn't want to go to class if he was going to be there. What's your reaction to that?
It's unfortunate. It's understandable. Like I said when we started, it's a scary disease. But there's absolutely no risk to any of the students at the university because not only has he not been exposed to, first of all, hopefully Casey does not contract Ebola. If she does, she's not contagious to someone else until she's exhibited signs and symptoms. If she or anyone else exhibited signs and symptoms, then the person that they transmitted the disease to would not be contagious until they exhibited signs and symptoms. That's why, with appropriate healthcare precautions, this is an easy disease to contain, and that's why although it's understandable, it's scary, but there's really no risk to the community of Fort Kent or any of the students at the university.
But Ted Wilbur is staying away from the university. What kind of message does this send?
I don't know. You'd have to ask the university. I don't know why they're doing that.
And your message to the community is that people don't need to be worried.
Correct. Yeah.
But the disease is evolving. Even as of just yesterday, federal CDC has updated and revised its guidelines. So with the disease that's evolving, do people have a right to have some concern?
People always have a right to have concern. Don't get me wrong, and I understand it's a scary disease. But the disease is not evolving. Our approach and our plan and our way of addressing it is evolving. So the disease has never been airborne. Hopefully it will never become airborne. And therefore, it's a relatively easy disease to kill with regular cleaning precautions. And so the thing that's changing is how we're dealing with our heroic healthcare workers who have decided to go and help fight this disease in the best way possible, which is going to West Africa to fight it. How we're dealing with them when they come home. That's what's evolving, and that's what's concerning and I think bringing forth so much anxiety amongst people.
That said, with the two of you as medical professionals, what was your reaction to how she was treated at University Hospital in Newark?
I don't know how she was treated there, so I really don't have a...
Did you, what her complaint, she said that the treatment was inhumane, she was put in a tent outside. That's what made all this a story initially, is that she was unhappy with the treatment.
So, you want to comment on that?
You know, we didn't have firsthand experience of what she experienced. You know, we certainly should herself or someone else come through our facility to seek medical assistance. we will treat them with the same compassion and dignity that we would any other patients. We cannot comment on how she was treated in New Jersey, but we can only say that we would empathize with any individual who would show up at our facility and would treat them with the same dignity and empathy that we would anyone else.
Casey Hickox and her boyfriend Ted Wilbur had a plan for her to come here to Fort Kent, Maine, and stay in his home. This is a remote area. Was there anything wrong with that plan?
We don't think so. We were not involved in that. We were not contacted. We heard it through the media. Again, we were already planning this. We had already had some tabletop exercises. Protocol had been in place. Training had been in place. And we are prepared, whether it's Casey or anyone else, to treat them just as we would with anyone else.
The real key with the location of either voluntary isolation, quarantine, is that the lack of exposure to public transportation, the public, and so any area, whether it be Fort Kent, Maine, or in Boston or New York, if the person is contained and they're not potentially exposing other people, it makes no difference. So whether it's here or somewhere else, they're under observation, whether it be direct or indirect. That's up to the determination of the CDC. So I don't have any problem with someone being here or anywhere else.
So after the 21 days, what next? 21 days comes and goes. Are you saying officially she's out of the woods and that?
Well, the current guidelines are that the maximum, most people present in the 7 to 10 day, I think the peak is 8 days now. There's now concern that in some bodily fluids, and for some people they can be potentially infectious for longer, if they've had the disease. If they've not had the disease and they're 21 days past exposure, they're clean, there's nothing else that they need to do. But these are for people that have had the, maybe I didn't understand your question. For someone who's had the disease, they're questioning, they're prolonging the period of.
But if she's not presenting symptoms after 21 days?
Then there's absolutely nothing else to be done with her in terms of monitoring or anything else.
Have you at all at any point spoken directly with Casey, or just all been through a third party?
No, I've not spoken to Casey. I don't know Casey.
And just to be clear, the plans you have in place, going back to 3 weeks, had nothing to do with any knowledge of her coming back, or
none whatsoever.
Just timed out that way?
No, this is all hospitals, I think, are putting in protocols in place to make sure that we're doing everything that we can to prevent the spread of the disease if a patient should present. So it should be no different than any other hospital.
And your thoughts on doing this plan and all of a sudden being thrust into the media spotlight within days of having done this?
Yeah, well, I thanked Elaine and Eric St. Pierre, our Director of Emergency Medicine. They're the two that put the protocol in place, and they did a spectacular job, and that's why we did it. So we're prepared. We didn't have to change anything as a result of this, so which is great. That tells you that you're doing the right thing.
This is something we do for other type of events that we could have, mass casualties, things like that. So we have protocols in place. We review them on a regular basis. We have exercises. So that comes in with what we do to be prepared to treat the members of our community.
Is there any reason at all to be concerned about the boyfriend if he is with Casey during her quarantine?
No, and not unless she ends up contracting Ebola. Then he would be at risk, obviously. But
he's free to move?
Absolutely. Yeah.
A question about the quarantine. You said that you're not sure that she's agreed to this 21-day period, but you're not sure where that quarantine will happen. Well, the clock has already started on the 21-day period, so would that be unwise to start your quarantine in one location and then move to a different location?
It doesn't matter unless she's, it's how she gets from one location to another. That's the concern. So wherever you're doing the quarantine, once someone's, if they're not symptomatic, they're not at risk for transmitting the disease. So it doesn't matter where the person is. And so it's just that in transport, if the day after moving from one facility to another they develop symptoms, well then you're wondering, okay, well that day before where they may be infectious, and then you have to trace the steps. So it's just nice to be able to do that by private vehicle or a way that it's not public transportation.
Do you expect that when and if she moved into this area that she would advise you, or that someone else would advise you that she is in the proximity here, might need care and support from you?
I've reached out to the CDC and to the Commissioner of Health, and we volunteered to be support. We've reached out to the boyfriend, and so we're here and available if anyone needs any help.
But do you expect that if she were to pull into Fort Kent, that you would know about it in pretty short order, or is that something that you might not
Probably
know?
thanks to you all, I would. Yeah. But no, we would have no contact with her or reason to contact her unless for some reason the CDC asked for our help in the monitoring.
How successful is self-quarantine and what's entailed in that? Because some original media reports said that she had a fever, that's why she was stopped in Jersey. So,
I'm sorry, I didn't understand your question.
I guess my question, I mean, originally, some media reports said originally that's why she was stopped or put into the quarantine down there where she had a fever.
Correct.
So, what's next with that? I mean, she doesn't have the fever, which is why they let her leave to go wherever she is right now. Could that, I mean, are those the beginnings of symptoms? I mean, why, first of all, why do you think the fever happened, do you think, or?
Yeah, I don't know why she had a fever, and like I said, I'm not intimately familiar with her case, but you can have a low-grade fever, which is what I understood she had for any type of viral syndrome. My understanding from what I read was that she was overheated, and there were some other concerns that she was, extremely anxious and worked up, and maybe in a warm area. So all of those things could cause a low-grade fever. But it's not just a fever. You have to have fever and other symptoms. So headache, muscle aches, developing diarrhea. You have to have other things. And most importantly, her fever, there was 2 negative tests following her having a fever. So her fever was not due to Ebola. We know that.
Can you elaborate on the CDC, Maine CDC's monitoring protocols to the degree that you're aware of it, and if there's any role for you to play in that?
So both the Maine CDC and the federal CDC have both updated their protocols yesterday, and I've reviewed them both. And so my understanding for their planned protocol for monitoring Casey is twice daily temperature readings, and then once a day a direct observation. And I don't know if that's going to be via Skype or an actual caregiver going in and doing an assessment. That's my understanding of how they're doing her. And if I refer you to the federal CDC interim U.S. guidelines for monitoring and movement of persons with potential virus, Ebola virus exposure, is an excellent document, and they document in there all of the different ways of monitoring patients, including, and they talk about the difference between quarantine, isolation, home monitoring, things like that.
So it's safe to assume that the direct monitoring would be conducted by local healthcare?
Not necessarily, no, that would be by the CDC themselves. They could incorporate a public health nurse or ask for our assistance, but it's all coordinated by the CDC.
And what will Casey Hickox's quarantine look like? She's not allowed to leave the house? Is she allowed to have visitors? What can you tell us about that?
So by the state of Maine protocol, my understanding is that she will be confined to her home. They'll provide her with anything that she needs. Yeah, so it says, we will work collaboratively with the affected individual to establish quarantine of the individual in his or her home for 21 days after the last possible exposure. So it's in-home quarantine for the state of Maine protocol.
And visitors?
To my understanding, you can have visitors as long as the person is not symptomatic.
You mentioned you expect to learn from the press if Casey Hickox were to come to this area. We don't know where she is. Does the CDC know where she is?
Well, the CDC knows where she is because they're monitoring her.
But you don't know where she is?
No, I do not.
Did they indicate that she'll indicate to you that she knew where Casey Hickox is?
Yes, because she's in direct communication with her.
And the Office of the Department of Health and Human Services Commissioners also had a direct conversation with Casey.
Thank you very much.